So, rewind back to over a year ago, September 2019. Remember those global climate strikes? Yeah, what happened to that?
Our first case of a novel coronavirus confirmed in a person here in British Columbia.
ICUs have reached a crisis point. Patients infected with COVID variants.
Coronavirus. It's been on our minds for well over a year now. Sustainability is conceptualized in multiple dimensions, such as environmental, social, and economic. When it comes to climate change and sustainability, where are we now and where might we end up? Today, I'm asking our faculty about our future after COVID.
In terms of thinking about sustainability and the work that I do, it might be surprising for people to know as a health services researcher that this is actually a concept that's important to me. Oftentimes we're thinking about things like planetary health when we think about sustainability or the environment, but health services and health systems are actually part of the everyday environment that we live our social lives within.
Greenhouse gas reduction is a global public good. It means it's a global collective action problem, and you need everybody acting. And that's really hard.
People with disabilities suddenly have found that their usual access routes have been blocked by cafes and other uses.
We don't resource the reduction of vulnerability. We resource reactions to devastation.
Canceled flights, closed offices, we saw a dip in carbon emissions during COVID-19. Mark Jaccard is an economist, author, and professor of sustainable energy at SFU.
People like me, our job is to help the media, concerned citizens through the media or through directly, and also governments themselves, if they're sincere, industry, non-government organizations, to assess if the policies really have their effect.
I feel like over the past year, we've been seeing a lot of, I guess I want to say like optimism in face of the entire pandemic. Like we have these memes, like nature is healing, we are the virus. There's this dip in carbon emissions globally. People, especially young people, I feel like are very hopeful that this pandemic has been like a wake-up call. Do you think that this will continue? Like, is this the new normal we're setting? Or are we going to kind of like have an emission rebound?
And my latest book is called The Citizen's Guide to Climate Success: Overcoming Myths That Hinder Progress. Now, and I say that because an important myth that most of us who want action on climate and we understand the science and we're very concerned is we'll say, oh my goodness, some people who get a job from maybe a coal mine or coal, an electric utility that uses coal to generate electricity, or oil sands development, or the automobile sector, or the refinery and oil fuel sector, that they are biased by their self-interest to discount the science or say we don't need to go very fast or things like that. And so that is one of the sort of myths that I say we need to overcome. But there are also myths that you kind of hint at, which I'll call wishful thinking biases, where we really want this bigger transformation. And so we look at any event like an economic recession in 2008 to 2011, that's going to change the nature of the economy, or a COVID pandemic, or a sudden movement for social justice, which goes like that over time. I don't want to discount it. It's wonderful what's going on, but they'll read too much into it. And so I guess my answer to your question is a caution, and here are the reasons why. One is that with the pandemic, what governments did is they just shut everything down. So in other words, the restaurant is still there, its heating system is still natural gas. The school is still there, its heating system. The fleets of trucks are still there. The airplanes are still there. Their fuel system, their engines all run on fossil fuels. So, and then what do governments do to relaunch the economy? Do they have to make a bunch of investments in wind turbines and things like that? No, the generating plants are already there. Do they need to make investments in transit? No, the vehicles are already there, and probably more people will use vehicles than did before because they'll be reluctant to take transit. So the entire, what we economists call capital stock, which is just simply the things that burn energy: a house, a car, an airplane, a factory. They're all still there. And all we're going to do, we turned them down. So emissions went down, and people kind of misinterpreted that as, oh my goodness, it's all changing. And they're all going to fire up again. And they're going to fire up again really quickly, and they are. And so, no, it won't be transformative. So the first part is no, sorry. The second part, though, is, okay, maybe there's things that are good that can happen from this. And, one of them is some kind of behavioral change, and maybe people wanting to live closer to where they work, I don't know, or maybe they want to live further away from the city. But there is a possibility that there will be things that come out of this that are good. And also, some of the money that government is spending, which they really don't, some of it they won't spend nearly as much as people think they are going to. Like, they're planning a lot of spending, and they're like, it's going to be green COVID recovery. They'll spend way less of that. When they see the economy starting to take off, and I think it will, but maybe it's 6 months from now, then they're gonna ramp down on their spending. And so you're not going to see this dramatic increase in all of these things like transit and green buses and so on and so forth. You'll see some of that. So the key thing, and also, by the way, the emissions are increasingly coming from the developing world. They're decreasing in the developed world. I mean, even if you took away Alberta and Saskatchewan, Canada's and BC a little bit, Canada's emissions are falling and have been for 10 years. So it's the developing world is the problem of climate, and we need to be thinking about that, whether it's more aid we give or we apply tariffs. So that's my long-winded answer. I hope that's okay.
When I think about sustainability and kind of like where we've come since COVID, I'm thinking to September 2019, when we had like these global movements, especially like youth, the climate strikes, and then suddenly we kind of like have this pandemic that's taking over like this media cycle. Would you say that COVID is kind of more of a distraction then, especially to politicians and policymakers, to like the bigger climate emergency?
Yes, and here's how I explain it in my book is, and I guess because I've been through a lot of things, it's just a function of getting old. So I have seen where we were so excited, especially right around 1990, 1989, 90, the Mulroney government in Canada, Margaret Thatcher in England. So this is ancient history for you, but it's like, I lived through this. And then it was, we had other issues. Ronald Reagan, the Great Recession, like people don't even remember that, like from the early 80s, the financial interest rate crisis. Then we had, we had wars, we had, so what happens is, interest in the climate will always go like this. And the reason is because the climate, decarbonization, stopping the burning of coal, oil, and natural gas is a multi-decade project. And in some cases we made great, like the building sector in Sweden is zero emission. Soon cars in Norway are zero emission. Electricity in Ontario was 1/4 coal, and in 10 years we knocked it down to almost zero emission, very low emission. Cars in Brazil. I can go on and on to show you that you take any major sector, we've been able to do these transitions, but they're piecemeal. And when have they happened? They've happened in little windows. We call these windows of opportunity. So the people I know are like, when we get a phase, as you said, about 2019, when it's at the top of the agenda, another thing has to happen. Some places in the world, they'll have a government that's climate sincere and can take advantage of that. Some places they won't. It might be Donald Trump is the president when Greta Thunberg is getting a lot of like, let's have global action. So it's really hard. Right now we've got Joe Biden. So what I'm trying to say, it isn't just the public interest, it's also all these other events, and it's the political cycle. Who's in power at that time? So we have a lot of things against us. And that's why people like me say, and some of my people, former students, colleagues, that they're like, if you've got a window, go. And in fact, that's why I'm a very busy person right now, because actually federally in Canada, we have a government that is very charged on climate. Some people I know are like, well, they're building the Trans Mountain Pipeline. They can't be sincere. I could care less about the Trans Mountain Pipeline. We're the only country in the world that's dramatically increasing its carbon price and telling industry about that. We're the only ones who are throwing in regulations to phase out all coal plants. We've got a very activist government right now, and it's even changing, perhaps, the Conservative Party, the opposition. So this is an exciting time in Canada, but is it the right time in the US? And so on. So you need to try to bring all this together. But all I'm saying is you bring it together for very quick time periods. So I'm not in despair about, I agree with your comment. COVID has diverted us from what was a good period, but it wasn't the perfect period. Donald Trump was still in power, and maybe Donald Trump helped get, or maybe COVID helped get Donald Trump out of power, for all I know. So, there's always some silver lining in things. So anyway, I guess my point is, yes, there's a distraction. COVID is a distraction on climate effort, but that's okay, because that happens all the time. There's going to be another war, I fear to say, a crisis, an international crisis, who knows what. And so you just have to seize little windows in different jurisdictions and try to stitch that together.
In terms of like the COP26 summit, which was delayed due to COVID and is apparently about to be delayed for a second time, do you have any thoughts on that?
I think regardless of when it happens, it could be that the next COP is a good one as they go, because we may have, the host being the UK, the American government in the right frame of mind, the Chinese government in the right frame of mind, the European governments in a pretty good state of mind. Not sure about India or Russia, but you're never going to get everyone. And that's the point. What I work on and what I talk about in the book is we need a global system of tariffs, carbon tariffs. These are an extra, we have tariffs for everything. Why don't we have a tariff to save the planet? Now, the reasons are the tariffs might be seen to hurt people in the developing world more than others, because it'll be like, if we are burning coal to make electricity and then our garment factory, there's an extra tariff on our garments that we're trying to import into North America or Europe, that doesn't sound fair. But you have to do that. The growth in greenhouse gas emissions is when I talk to utility managers, about to build the next coal electricity plant in Vietnam or Indonesia or Pakistan or India, all of what they look at is the cheapest option. And that's what's going to drive up emissions. If we can use tariffs and it will make it a little harder for economic growth in those countries, but it's going to save them huge amounts from the devastation of climate change. It's the only way we get global action, because it isn't going to be all the governments agreeing all the time. There will always be a government in India or China or Tanzania or wherever who has to make a difficult trade-off and ends up saying, we'll develop a gasoline transportation system, we'll develop coal-fired and natural gas power plants. And we need to make it in their financial interest to not do that. And then there will be economic growth from that, and will prevent all the horrors, which will have the biggest impact in the developing world because they have less infrastructure, human capital to weather the storm. And so I'm hoping that the next COP focuses on tariffs. And I don't know if it will. I'm someone who lobbies for that. There's a possibility because of where the Europeans are at right now and the Biden administration, but I really don't know.
COVID has highlighted a lot of the vulnerabilities within our society. Valorie Crooks is a professor in a geography department who studies health geography and is a health services researcher. During this pandemic, she has been working to help map the vulnerabilities to COVID-19.
And in this project, we've been looking at using a vulnerability approach to understand neighborhoods that have greater risks to COVID-19 exposures relative to others across British Columbia, based on a whole number of factors that we've factored in using a model that we've developed for this purpose. And I'll let you know, actually, we're working on some next steps in this project. So one of the steps that we're working on right now is actually looking at those risks of experiencing long-term health effects of the pandemic. So not people who develop COVID-19 and their symptoms, but actually many of us are going to have our health affected by the pandemic in one way or another, whether it has to do with changes in our household and employment context, changes in our everyday routines. All of these changes are bringing on various kinds of stress events. We're seeing some occurrence of depression being diagnosed. And so our team is working on modeling that, looking at a spatial approach, again, to develop maps that will be available for the public to look at and explore.
When you talk about kind of moving beyond COVID and like back to work, is this map kind of like a tool that'll help guide us through, I guess, like what policies are implemented?
So the sort of next stage of our project, it's going to be really relevant, especially to policymakers and healthcare administrators that are thinking about resource allocation to deal with the health effects of the pandemic at large. So in our work, we're identifying neighborhoods that experience a certain level of risk or vulnerability to these based on the activities that people undertake within them and also the profiles of who lives there, as well as in some cases, the kind of places that exist within them. And so healthcare administrators are going to be able to look at these maps and use them as part of a decision-making tool complement. So the work that we've been working on with Dr. Sherman and I around COVID-19 and mapping, it's never been intended to be a single source of decision support for those that are making important public health decisions in this pandemic. It's meant to be a tool that can be consulted by those that are looking to gather all kinds of information to make informed decisions. And we're really delighted to be part of helping to contribute to that and to offer a geographic lens to this opportunity.
Medical tourism is the practice of traveling to another country in order to receive healthcare services. Do you think that's going to be like a thing, or is that already happening with people kind of traveling to get like COVID vaccines, for example?
For myself, as somebody who's been looking at the ethical and equity dimensions of medical tourism for over a decade, my stance is very clear, which is that vaccine tourism should not be viewed as a solution towards ending the COVID-19 pandemic in any way. There's a lot of ethical and equity challenges that relate to moving people across borders to consume medical resources or healthcare resources. So it introduces a number of very significant questions, even in relation to malpractice and travel health insurance coverage and the opportunities under which actually people's actions may be nullified as a result of this travel. There are other concerns that exist as well with regard to people actually accessing vaccines abroad that have yet to be approved in their home jurisdiction. Another concern that also exists is that not just with vaccination, but any time that you access medical care abroad, it can actually be really challenging to get that information as part of your medical record here in Canada. And so there's an additional challenge because in Canada, and not just Canada, but other countries around the world are building vaccine registries that are robust, that report all information with regard to vaccination among those within the country. And so when you're bringing that record in from abroad, will you receive the information that's needed? But overall, again, in terms of thinking about vaccine tourism as a solution to open up the tourism sector and tourism-dependent destinations, which are really the groups of countries that are very highly interested in opening this up. So for example, I see often discussions of this on the Caribbean news mentioned from a number of different countries, especially with the pending approval of a vaccine based in Cuba. But this is a short-term kind of band-aid solution type of approach to long-term systemic issues of not having enough diversification of economic activities in tourism-dependent destinations. So, again, with regard to thinking about vaccine tourism as an opportunity to open up the touristic sector, we have to really wonder how much of a contribution to the economy will be made by tourists, quote unquote, who are planning to come in, become vaccinated, likely to stay for relatively short periods of time and then return to their home countries.
We've heard a lot of concerns about mental health beyond COVID, and especially with like the overdose crisis that's also been augmented by COVID.
Exactly. And in fact, here in British Columbia, this has been an existing crisis that predates the onset of the COVID-19 pandemic. Once again, Nadine and I are collaborating in this case with people based at the BC CDC. And we're at the early stages of trying to work with a group to develop an understanding of some of the ways in which the built environment actually can tell us really important information with regard to the overdose crisis and specifically where overdoses are occurring. Knowing this information actually can help us once again sort of concentrate our service allocation or resource allocation in order to help to better support what it is that's going on. Because as you were alluding to, this is a crisis, an absolute crisis in the province of BC that predates COVID-19 and will exist following the last person that receives a vaccine and the last identified COVID-19 case that's active in the province.
Our cities have changed a lot since COVID with social distancing and working from home. Eugene McCann is a professor in our geography department who studies urban political geography. There have been a lot of talk about, people moving out of the city and into rural areas, kind of like a migration as remote working becomes more popular. Is that necessarily a thing or a trend that you see continuing as we move past COVID?
I think it's too early to tell. It obviously relates to the geographies of firms and companies. Are they still willing to have offices where people cluster together physically, or are they looking to move to remote working? Also, the question of whether people are moving out of the city to remote locations purely as a result of not wanting to be as close to other people. I think again, it's way too early to really know if that's the case. The COVID crisis has led to concerns about the economy, the health of the economy, which has tended to lead central banks to reduce interest rates. And one of the effects of that then is that people feel as if they can buy more house. So some of the people who may be moving out of cities may be people who are already looking to move out and who are taking advantage of lower interest rates to buy places. But that's having an effect. That same lower interest rate thing is having an effect in cities as well, where the prices of houses, the number that are being sold quickly, all of that is going up even within cities. So I think it's something that's interesting to watch.
There has been a lot of talk about urban spaces and public spaces and having enough accessible space now that we have social distancing. How do you kind of see that public space being negotiated?
Well, I think there's a couple of things there. I mean, I think we've already seen a trend over the last 20, 30 years where the character of public space has changed quite significantly, and classic ideas of public space where they're fully free for access to everybody, where they're owned in common or owned by the state, have these kind of visions of public space have been undermined by neoliberalized models of public space, where often there's this idea of privately owned public spaces, where corporations or developers donate a certain area of a plaza to public uses, but it's still within a private ownership model, and there's a lot of rules about who can be in it at certain times and so on. And that in itself, I think, just raises the question of how much the contemporary society really values truly public spaces, and I think the evidence in the last 30 years suggests that maybe not quite as much as we might like to tell ourselves sometimes. But that's not to say, on the other hand, that public spaces haven't been really important in the last year, and it's not to say that public spaces aren't important to many people and couldn't be, and also that maybe the last year has shown how they are really important when people want to be together, but as you said, distance a little bit more and out in the outdoors. But then that raises the second question, which is what has tended to happen in the last year around public space is that there has been a sort of even as there's been a shift towards the use of public space because it allows people to be outdoors but still together, in a lot of places there's also been this kind of contradictory privatization of those spaces. So for example, the ways in which outdoor patios of restaurants have been allowed to spill out across sidewalks. And of course, in some places in the world, that's always been the way it is, and it's seen as being a charming feature of certain European cities, for example. But in North America, that's quite novel. And it's happened very quickly without a lot of deliberation. For those students who are interested in thinking about the role of cities in the future, the opportunities in the Faculty of Environment are excellent for that, with a series of courses and numerous professors who do really interesting work on urban issues. And cities and processes of urbanisation are clearly going to be central to the future of our societies in years to come.
The economy was hit hard during COVID-19. Jeremy Stone is the director of the Community Economic Development Program at SFU. In regards to kind of economic development and these like businesses, how has like the impact of COVID been?
I mean, it's an interesting quote unquote disaster because in many ways it doesn't have any of the major characteristics of disaster. It's not destroying buildings and it's not, shutting down cities, et cetera, but it has these very individual effects on people and on businesses. And so, I think it's been catastrophic for many businesses. They have routines and they depend on those routines. They depend on Saturdays because customers are walking, the commercial corridor on Saturdays. And then when Saturdays effectively stop, like people stop coming out, then it disrupts their ability to make money, ability to pay rent, it disrupts their business models, their ability to pay loans, like people are taking out debt to run their businesses. And then, they assume that they're going to have that many Saturdays for like 5 years. And when a whole year of Saturdays is taken away, it's a huge impact.
What we've seen is that a lot of smaller businesses, especially local businesses, appear to be impacted more. Do you kind of like see them coming back like post-COVID?
Well, yes and no. I mean, I think that yes, in the sense there will hopefully always be economic activity. There will always be entrepreneurs who want to, to provide us with our life needs, because that's what small businesses are. I mean, they're our providers of everyday life, our food, our medicine, our clothes, everything. But I think at the same time, we have a lot of businesses that have been impacted. A lot will go out of business. And then other businesses and other entrepreneurs will fill those spaces. And so, when we talk about will businesses come back, will economic activity come back? Yes, but we're going to have a lot of people who suffer in the meantime, a lot of businesses that will go out. And I think our major concern needs to be, how does that function from a perspective of justice? How can we make sure that our most vulnerable entrepreneurs, our most vulnerable sectors of society are supported through this? And so it really remains to be seen, how the impacts will be felt and whether or not, those communities will continue to suffer the impacts that others aren't necessarily.
We've kind of seen the importance of I guess like the gig economy as like Uber Eats and like delivery and like those things that kind of have really proliferated with people not really being able to like go outside anymore. Do you think that's kind of like highlighted the precarity of I guess people who are like self-employed or like contracted out?
This is a really big question, because I think that on the one hand, we have, as a society over the past 50 years have experienced increasing fragmentation of work. So, work has been breaking down. The 9-to-5 job is no longer, the major job everyone has. People are becoming more dependent on bits and pieces of work. And so, the Uberization of the food sector and whatnot is I think, problematic. At the same time, there are certainly people who are capitalizing on it and doing really well, with it. And we're seeing, Skip the Dishes and all these folks, bringing on these, gig workers to do this stuff. And I think also, now the shift to working from home, I think, has enabled gig working in a lot of ways. And, we don't need to necessarily have office space all the time. But I think that rather than, taking these as, celebrating these stories and saying, oh, look, at how we've, got now all these people shifting to, Uber driving with food, we should actually be saying, well, okay, but what does this really say about our broader society? Are all these people able to get, their rent paid? Are they able to, get enough money for food? Like, are they able to reinvest in themselves and their family? And I think, the precarity is increasing. We'll see, it's not just my opinion, we'll see what the data says, but I think just colloquially, precarity is increasing.
But can you tell me a little bit more about building resilience in our communities? How do we disaster proof our society? Is that possible?
Disaster proofing would be awesome. I think that, the flip side of disruption, or, the counterpoint to disruption and disaster is vulnerability. And if we are, you don't have a disaster if you don't have vulnerability. If you have like an earthquake and none of the buildings fall down and none of the people get impacted, then you didn't have a disaster, you just had shaking. And I think that whenever we look at any of these issues, whether it's a economic disruption or a natural disaster or something like that, you've really got to ask, well, how are people vulnerable and how are we mitigating that vulnerability and how are we changing the course of their daily lives so that they can be resilient and adapt to these changes? And so I think, if you're talking about how do we future-proof our economy or future-proof our society, we have to be talking about, well, how dedicated are we to social justice? How dedicated are we to equity? Until we deal with, the fact that income inequality is so great and, access to life, different life outcomes is so constrained by race and gender and class and all these things, until we deal with that, no, we can't future-proof. We can maybe reduce the risks from flooding or whatnot, but people will still, be impacted by other forms of disruption.
2020 was a big year for social justice movements.
I think that there is a lot of hope in our society because at the same time that we've been experiencing this, we have been experiencing other, issues and progress around key issues. So, I think that, everything that happened with George Floyd and Black Lives Matter at the same time that the COVID pandemic was starting, it's been very important, I think, for our society to reckon more with these issues and I think that it is, mapped on that, like, say, Black businesses in Vancouver are not only facing, institutionalized racism, but they're also facing, COVID impacts. And so, I think what gives me hope is that we're seeing the interconnections with justice and progress and, justice and economic stability. And so I'm hoping that as we come out of COVID, we will recognize that we need, better planning for disruption. We need to better reduce vulnerability, etc.
Black Urbanist, like there's a Canadian planner called Jay Pitter, for example, another one called Amina Yazin. She wrote a paper, a very good paper with another planner called Daniela Ferguson. And there's others in other parts of the world too, who all turn around to that statement about public space being good for everyone in the current context and say, well, actually, the same regimes of policing and surveillance and differentiation among people in terms of their race, their class, and so on. Those are all still there, and if we don't address those deeper structural inequalities, then maybe changing the design of a particular public space won't really improve society that much.
Am I cynical at the same time? Yes, and I think that, when you look at municipalities, especially, they're kind of skittish about some of these issues. They don't necessarily want to stick themselves in the middle of it and necessarily lead and push. They're going to be really responsive to how voters act and how the culture sort of changes and adapts. And so, I think I'm hopeful, but I'm concerned that we don't have enough leadership in this space.
I think the protests after George Floyd's death or murder are probably related in some ways to the fact that people were paying more attention for sustained periods of time, partly because other things that might have attracted attention weren't there in the same way, and people really focused on that, and it really highlighted a set of injustices which of course have been there for much longer. I think the character of these movements often fluctuates over time. So the being out in the street thing happens for a certain amount of time, but then the movements will often sort of step back into more protected spaces as they work out next steps and so on. Other movements, though, are clearly related to COVID. So you can see over the last year there has been a real push in many places for new forms of mutual aid to be operationalized within cities. So providing free food, providing food to vulnerable populations, for example, has been a big one. And then, of course, related to that have been demands for things like moratoriums on evictions, or more radically still, the abolition of rent and privatized housing and so on. These kind of things also basic income. These are all things that have all existed for a long time before, both as ideas for making the world better and also as critiques of what's wrong with cities at the moment. But the crisis, I think, has catalyzed them and also combined them in interesting ways.
I first started in the area of critical disability studies, looking at employment and healthcare experiences among those with contested chronic illnesses. And one thing I know in terms of workplace or workforce accommodations is that for many people, it's a very siloed approach that can take a very extended period of negotiation in order to do things like get approval to work from home. And now here I am working from my house with no long-term approvals that were sought in order to do so. And so again, there are many disability advocates who have said that in the last year, we have made leaps and bounds forward that we would like to figure out ways to retain once we're in a post-COVID society. So these are some of the kinds of things that are on my mind in terms of seeing how approaches that we've undertaken to address immediate issues as a result of the transformations that we've seen throughout the course of the pandemic have actually resulted in positive changes that we would like to see implemented in the long term.
When it comes to COVID, the future is still unclear. But if there's one thing for sure, is that change is still coming.
People who are already vulnerable or marginalized, are they going to be the ones who suffer the brunt of this?
What does it mean to build a sustainable health system that meets the equity needs in particular of system users?
We have to think strategically. We have to learn from 30 years of failure.
The jury is still out in some ways, and there's still probably a lot more debate and struggle to take place about what the future of the city might look like.
Can you maybe walk me through briefly about how this book came to be, who should read it?
Thanks for asking me about the book. The book is a culmination of many years of thought about this problem. I'm an expert in the economy and the energy system, and I've been on the Intergovernmental Panel on Climate Change, as I am again, a lot of international panels, the China Council for International Cooperation on Environment and Development for 20 years. And in these processes, I noticed that over and over again, the academic research we did was always on how to design a carbon price or a cap and trade or some kind of regulations, all of which I'm in favor of. And politicians then sometimes would be sincere, but they would never put them in at stringencies that are needed, at levels that are needed. And I realized increasingly that people like me at least some of us, if we think we have any kind of ability to write, and I'm somebody who's always written a lot for the public, op-eds, essays, and popular writing, non-expert stuff, kind of owed it to the rest of society to be trying to get the message spread a bit wider. So, just as a climate scientist might say, I want more people to understand climate science, and I get that. But actually, we don't need to convince everyone about climate science, and we don't need to convince everyone about a carbon price or about a regulation. We just need to get enough climate-sincere people who are active to make that happen, politically and as civilian activism. And so that's why I wrote that book. It's got different chapters in it about strategies. Like if someone says to you, when you're going to get on that airplane, buy an offset, and then you won't have to go, then you can feel good, and it's, and go ahead and do it. And this ends up saying, well, no, actually, there's a real problem with that. Here's what the experts say. Or it says we're going to stop eating meat, or we have to do all of these big behavioral things. I think a lot of the behavioral things we're talking about, flying less, driving less, eating less or no meat, are really good things for a whole bunch of reasons. Fortunately, though, they're not essential for hitting our decarbonization objective. The real thing is what you can do as individuals, how to be an active citizen, and what you do with your own emissions. And so that's what the book